I've told many people that when they say, why do you want to be a male nurse? I say, well, I don't want to be a male nurse. I want to be a nurse, and I just happen to be male.
I've always enjoyed helping people.
I get to have hands-on, communicate with people, help people when they're in the most vulnerable states. So.
It's not a boring field. It's not where you're going to come into work every day, sit at a desk, stare at a computer for the 8 hours they have to do that, and then go home. You actually get to run around. You get to do stuff. You're very busy the whole time, which makes time go a lot faster, and it's a lot more interesting than your standard desk job.
I'm not a big one to have somebody say, oh, you're too old to do this. There's no age limit on it. If you've got the energy to do it and you want to work, then make it happen.
There's a lot of opportunities in nursing for men. You could either be a nurse in a hospital, a nurse in nursing home, a doctor's office. You can go into one of the specialties. You can deal with geriatrics, adolescents, pediatrics, mother, baby. So there's a lot of room to find what you would want to do as a nurse.
There's multiple ways to become a nurse. Now, regardless of which route you choose to become a nurse, there's two components in any nursing program. There's the classroom component and there's the clinical component.
Well, it's a lot of studying, a lot of reading, a lot of anatomy and physiology, a lot of medications to remember and what they do and side effects.
I mean, there's a lot of book work. There's also a lot of hands-on stuff in the labs.
It's a lot of just practicing basic nursing skills. We had to learn how to do catheters, and we have dummies for that.
It's hooked up to this computer that is supposed to simulate the vitals and all that stuff that you'd see at a hospital, and the teacher can make it crash. I mean, it's one of those things that you don't see very often, but it's really cool to work with.
The clinical is where you apply the classroom theory. You actually get exposure to working in the clinical environment, hands-on patient care. And that's really the crucial element to nursing education.
You have to be able to work with other people. You need to be able to work with your coworker. Nurses usually work as a team.
It takes a lot of organizational skills. Prioritizing. You're always thinking you have to because people's lives are at stake. Physically, there's a lot of involvement with the patients, transferring, lifting, things like that, which is where a lot of my female counterparts are happy to have a male on the floor.
It is a very physical job, especially if you are taking care of patients that have mobility problems.
You need to be on your feet, you need to be able to move quickly, you need to be able to think clearly and process. Really, the whole thing is prioritizing details.
You can't help but be involved emotionally.
There was really no easy way to prepare to get used to seeing someone who the next day may be dead. We've worked in plenty of nursing homes, and a lot of them are on the very latter end of their stay there, and it gets difficult, but eventually you just got to get used to it and leave it all in the nursing home when you go home.
You move on. It happens all the time in nursing.
I can't have any sort of doubt or hesitation in anything I do, because if I do, they'll think, oh, I don't know what I'm talking about, bring me a real nurse, which they would see as a female nurse.
It is a stereotype, and it's a stereotype that I see that's gradually wearing away, but it's still out there. It's the perception that the nurse is the woman in white who is the angel of mercy.
A lot of them traditionally view the female as the one to be able to do all the care.
And a lot of guys, they think, well, I don't want to go into a woman's profession. But once they see beyond that stereotype and they see all the different types of nursing jobs that are out there, they see that it's a job role, not a gender role. That there's something out there for everybody in the nursing profession.
I really haven't had any problems with people looking down on me as a man into nursing. In fact, I'm finding just the opposite in our clinical sites. They seem to really welcome guys into the profession.
There's also the aspect of the male camaraderie. that just as some women are not comfortable talking to male healthcare providers about things, there are times where male patients are not comfortable talking with female healthcare providers. So that's where the male camaraderie comes in. So if we can continue to strive to break down that stereotypical gender perception, it's going to open up the profession more and more all the time.
I think getting into the profession, we have a little bit better chances or jobs than women might have, because there's so few male nurses, and then we have a much easier time with some of the more physical aspects of the job.
It's probably one of the only careers that there is quote-unquote job security, where there's so much demand for nurses that, you know, it's not hard to get a job as a nurse. And there's so many different things a nurse can do.
I've had several people approach me about what my plans are. They always are saying, hey, what are you going to be doing after you graduate? Are you looking for a job? I mean, I definitely recommend it. I mean, so far from what I've been experiencing, I don't have to worry about getting a job afterwards. I know there's plenty of places that need male nurses.
I like doing the work of a nurse, but I actually admit I also do it for the financial benefits and rewards.
There are really very few businesses that run 24/7, 365. And since all of us have medical needs and have medical issues that come up over time, whether it's personal or whether it's family, it's a great business to be in because it is always there.
So, I mean, it's a great profession. I mean, you can't outsource your job, especially nowadays. They need more nurses.
Most people do not get into nursing because of the money. I mean, some people do, but it's more likely that there are other aspects of your personality that make you want to become a nurse. You have to actually want to be able to take care of people. You have to want to help people. And I think that's really important. If you don't have that, you probably don't want to go into this profession.
When you're able to make somebody more comfortable than they were before you came in, to be able to meet their needs and put a smile on their face to know that you actually, you know, did something for somebody is the most gratifying.
I think one of the more satisfying aspects is seeing someone get better, seeing someone improve, and know that you had a hand in helping them to get better.
There are an awful lot of professions where you have to put your focus on yourself and your career and the whole bit. Nursing is one where you really need to put your focus in on the others, on the patients and their families. So it's very nice and unique in that respect.
What it really comes down to is it's all about caring about people, and it's all about helping people. That's what the profession is all about. And to me, that's not always existent in other types of professions.
My name is Hersey Gray, and I decided to become a nurse.
My name is Dave Turner, and I've decided to become a nurse.
My name is Tyler Foster, and I decided to become a nurse.
My name is Jim White, and I decided to become a nurse.
My name is Alan Foreman, and I am a nurse.